In the healthcare system, medical errors are prevented by two separate but equally important structures: health information technology and the people that use them. These are their stories.
Hi, can I help you?
Yes, I'm looking for the Baylor training classroom.
You're Major Moten.
I am.
Hi, I'm Sheila. I'm the trainer. I've been expecting you if you'll follow me.
Absolutely, thank you.
Our best practice focused on the importance of implementing standardized training methods for health information technology, commonly referred to as HIT system, in order to facilitate and sustain proper documentation actions. This video will provide two illustrations of HIT training practices. One situation involves inadequate training methods, while the other implements evidence-based practices. So let's watch.
Okay, Major Moten, I'll set you up a station. Please have a seat. First off, I'd like to welcome you to our organization, but I have to warn you, we are a little tech savvy here, okay? We have lots of new health information technology. We specifically use WIMS and I here. Are you familiar with WIMS and I?
No, I don't know.
Okay, it's a classification for nurses on the floor. We don't do so well at it. We probably rated about 60% compliance, but you look really smart and I think you'll catch on. So I'm just gonna give you a few books. I'll probably give you maybe until Tuesday to read these. 2 days should be enough.
2 days?
Yeah, 2 days should be enough. Now, if you'll log on, I'll show you the website. There's about 22 chapters that you'll need to go through, but don't worry. You can just hit next and skip through all the exams, okay? So like I said, you can just click through the actual exams, but I'm gonna show you how it works, give you an overview of the system. It's really easy. All you do is you pick your patient and then you
click on here and put the number of times that you did it. And then click on here. All the ones that are pretty much relevant for your patient are the ones you're gonna do. But you gotta be careful because some of them you can't pick more than one and some of these you only pick once per shift. It's a little complicated at times, but I'm sure you'll be fine. And then all you do is just hit complete and then you're done for the entire shift.
That sounds complicated.
No, it's really not. I just walked you through it.
You are currently witnessing an example of an inadequate training method involving HIT systems. Studies have shown that poor training resulted in improper coding, unprepared staff, additional work tasks, and higher safety risk. This is a notable issue in the military health system, where different service lines have established their own training techniques for HIT platforms that are currently being used enterprise-wide. Many scholars have agreed that effective system usage will be unattainable without properly supporting the human-system interaction in HIT programs. In a moment, you will see how training inefficiencies can affect the quality of patient care.
Come in.
Hey, how are you doing, Mr. Johnson? I just came in to check on you and do a little chart. How you feeling today? You doing all right? Okay, good deal. Right. I got you.
Ain't that supposed to be on?
No, you all right, Mr. Johnson. Don't worry about it. See if I can remember my password. I don't know what's wrong with this stupid thing.
Major Mountain, how's your documentation going?
Oh, fine, ma'am. It's no problems at all.
Yeah, well, I've been noticing that there's not enough documentation in Whimsonite, so we don't have nearly enough nurses around here.
What do you mean?
Well, you know, you looked at all the books and did all the training for Whimsonite, right?
I mean, I got some books, but I mean, those are really big books.
Well, those 15 books tell you exactly how to do the Whimsonite training so that we can get more nurses on the floor.
But I only got 9 books.
Oh, well, we'll have to get you those, I think. We really have to get you, better trained on that Whimsonite training.
Okay, ma'am. I mean, I guess.
Yeah.
Whatever you want me to do.
Good deal.
Cool.
Ooh.
This scenario will implement the interventions identified in our literature review. These interventions are effective means to achieving staff acceptance, staff competence, and staff confidence in health IT systems. One recommended practice is employing a blended training method. In the blended training method, trainees are immersed in a multi-delivery construct involving observations of system functions and features while including active learning activities that explain how to properly leverage the technology in clinical settings. This leads to a high-quality training program that supports the audio, visual, and tangible learner. In-class instructions, coupled with online training programs and practical exercises, are all parts of a successful training program.
You're just going to kind of pick what applies to your patient, and then pick how many times a day you're going to have to do that for your individual patient.
You got new people?
Oh, Major Moten, this is Quincy. He's a former student of mine.
How's it going? How's it going, Major?
Quincy, why don't you tell him about your experience with Whimsonite?
I mean, well, just so you know, first, when we first in this organization was doing training for women and I, it was just all over the place. I mean, they used to just give me books to read and there's some online training. And I mean, I really didn't have any kind of standardization process to kind of learn how to use, HIT systems and stuff. However, now we have this blended training and, super users on the floor and everything. And the great training by Ms. Tyndall, they really kind of put the effort into making sure I understand the process, learning how to really use the system and a very proficient at it. So now I really feel that self-efficacy building up inside of me, like Gabriella and things like that nature. So,
Oh, that's great to hear because I was really kind of getting frustrated, but now that I know that there are other nurses on the floor that struggled I feel like I'm struggling now, but have been able to gain a mastery of the program, I really appreciate it.
No, you're going to do great.
It is also important to talk about past experiences and share personal testimonies. The social cognitive theory suggests people are more apt to change behavior if there is a perceived value of outcomes associated with that change. Revealing past dysfunction while sharing current and future improvements from fellow peers facilitates that desired change in behavior.
Oh, hello, Ed.
Hi, ma'am.
Please sit down. Oh, Whimsonite. That's a wonderful program. And it's so critical to our outfit here. So it needs to be used in the correct way, though. That's very important. That's critical to our operations.
Oh yeah, the instructor was talking about how good a value it brings to the organization, so absolutely.
Exactly, I agree.
Active leadership involvement is critical to successful implementation. They help set the organizational attitude towards health IT usage. Just as important are role models such as clinical leaders and staff. Similar to Cotter's 8-step change model, they formed a coalition that discussed the importance of HIT systems and the value it has for positive patient outcomes.
Major Mountain? Hey, I'm Krista.
Hi,
I'm
Krista.
one of the nurses on the floor. I want to make sure and introduce myself. I'm one of the super users for Whimsonite.
Super user?
Yeah, so I think you went through all that training here at the beginning of your orientation.
Yeah.
Well, to supplement that, we want to make sure and have somebody around that you can ask questions to.
Oh, wow.
So I'm the person for this board.
Oh, awesome. I actually do have some questions if you have time.
Oh yeah, let's go over it right now.
Sure.
Thank goodness.
So I've been working with my patient here, and I was just struggling with how I should enter these certain things into the computer. If you could help me
Perfect.
with that.
All right, so first you go to this section.
Super users support sustainability efforts by providing new utilizers of HIT systems a role model to emulate and a frontline resource to refer to for guidance or assistance. They intrinsically motivate new users to believe in their capabilities, and they contribute to better learning outcomes.
Okay.
Wow, that really helped a lot.
Yeah, so then you're able to put several of those, and if somebody else helps you, you want to make sure and multiply it by the number of staff people it takes.
Oh wow! I mean that makes complete sense.
Yeah.
So what else do you do as a super user? I mean, do you do stuff like trends, or or do you monitor what we do and then give us some helpful hints
Definitely.
on,
So I'm able to look back at the history and see, what we might not be capturing very well.
Oh wow!
And
Okay.
then we'll do training every once in a while, and focus on this for a while, and try and make sure you're getting enough of these.
I
Yeah.
tell you, that sounds it's like such a relief, because I was really kind of struggling over here. So I appreciate you stepping in and helping me out.
Well, we're so glad you're here, so thank you for coming on with us.
Thank you.
Welcome everybody. Today we're going to start our staff meeting off with Krista. She's our WebSenai super user. She's going to go over some information for you guys.
You guys, I am really happy to report 100% classification. That is amazing. Way to go.
Having a multi-delivery training method and utilizing super users are vital to improving safety and quality. Outcomes from proper implementation include improved work and time classification, employee satisfaction and competence, enriched data quality and safety efforts, and potential cost savings due to providing efficient patient care and from the high-tech's meaningful use incentives.
I don't want a shark violation.
Oh,
So.
please, because I'll have it on film.
Exactly. So if you look,
Somebody have.
That's Mr. Johnson right there, huh? This is a leg.
So, yeah. You guys are really good at all those things, and we're nurses.
yeah, nurses are staff. It's very
It's really good. It's really, really good.
good.
I'm glad to have you on board doing a really good job. Yeah, you're a fast learner.
Yeah, the instructor was talking about how good a value it brings to the organization. So absolutely.
Exactly, I agree. So, I don't really know what else to say, but,
Oh, that's okay. You don't have to worry about what you say.
Wonderful.
Just
So-
keep moving your mouth.
okay, so you've been working on it, and are you getting ready to train people?
Oh, not. I don't think I'm good, but I am learning the system.
Okay.
Okay, you can
I'll
wrap it
work
up.
with you.
Okay.
So, welcome again, because it's really
Thank you, man.